minutes. Joining us, Dr. Timothy Quinn, to talk about it. All right, so Dr. Quinn, talk to me about how, for people who may not recognize an overdose right away, what is some of the key warning signs that someone could be possibly very serious trouble?
Well, you have to look at the risk factors. The most common risk factor is a known history of using any type of opioid type drugs, either prescribed or they bought it from the street. Like maybe they use cocaine or they use other drugs that are bought in the streets. But if that person has a history, then there should be a high index of suspicion if they start showing symptoms or signs. And some of these symptoms or signs would include an individual that's in and out of consciousness, they're confused, maybe they're having problems breathing. But the key thing that we look at as physicians when they come into the emergency room is we look at what's called their pupils. If they have something called pinpoint pupils, where the pupils don't constrict and dilate with light, then we have a higher index of suspicion. And we'll go ahead and do the Narcan, which is a nasal spray. You lay the person down and you spray it in their nose, a couple of squirts. And within minutes, like you said, what happens is this Narcan is what's called an opioid receptor antagonist. So it'll go to the receptors in your brain where the narcotics are causing the overdose, and it could reverse it within a few minutes and the person is better. But what I really want to stress is if you use the Narcan, also make sure you call 911 because it only lasts about 30 to 90 minutes. And once it wears off, and then if they still have a high dose of opioids in their bloodstream, it can get back in those receptors and they can have another overdose. That's why it's best to call 911 so that the person can be evaluated before 90 minutes. If you're in, close enough to a hospital. If you're not, and you know you're not gonna get them there quick enough, then it's suggested to have two. And it really works, and it could save that person's life.
And you can obtain Narcan over the counter, right?
That is correct. You can go to any drugstore. If you have a family member or yourself or someone you care about, like a neighbor that you know has a problem with drugs, it's best if you could have the Narcan available in your home or their home and just be knowledgeable about it.
All right, if there's something that people could take away or 12 News viewers could take away from this segment, what would you like that to be?
Well, just know that if you have someone in your life that has a problem with drugs, you want to try to get them help. And in the event that the help doesn't work, then you want to know about Narcan, which could save their life if they encounter an overdose. Maybe they get too much. And then there's a drug called fentanyl, which is a synthetic opioid that drug dealers will use because it's a lot less expensive. And note that people can overdose off prescription medications as well. So if you take prescription medications, keep them locked up away from young people so that they can't, use them inappropriately and get into trouble.
All right, take the amount that is prescribed to you. Thank you so much, Dr. Quinn. We appreciate your time.
Hey, thank you.